Everyone, so let's start with the session. Let me just check, am I audible? Is the screen clear so that we can start the session? Let me just have a check. So yes, my dear aspirants, this is the session of the connective tissue targeted for the first year MBBS students and also for the next aspirants. So this will be highly beneficial for the aspirants. So yes, just have a check, connective tissue sessions. So yes, I am audible and the screen is clear, so we can start the session now. Okay, so yes, we can start the session now. This is targeted for the examination of the next. Okay. So yes, my dear aspirants, myself Dr.Monalisa, MD Anatomy from Armed Force Medical College, Pune, and has got a total of 9 years of teaching experience. When I am talking about the special class feature, it's a highly interactive session where the learners and educators interact. So you can also go for the plus subscription, and before that, just few points about the special classes. It's an interactive session where the learners and educators can interact. Polls are conducted and you can participate in the polls, raise your hands, get your doubts clear right itself when the session is going on, and this will be highly beneficial for you. Raise your hands and never ever miss a session. Once the session is finished, PDF notes can be also downloaded. That is highly beneficial. Anytime, anywhere, read from the top educators of Unacademy platform. Let's talk about the plus subscription. Plus subscription, all 19 subjects can be targeted in a very systematic way. You can access both live and recorded version. You can study from India's top educator, compete in live test and quizzes, study on the device of your choice, and have an access to 25,000 more MCQs made by the top educators of Unacademy platform with a detailed explanation for each and every MCQs. So use this code NAT10 and get an extra discount of 20%. Let's talk about iconic subscription. So when I am talking about iconic subscription, you can have the merging of Unacademy and Prep Ladder. There also you can utilize this code and get an extra discount of 20% if you are going to take the subscription till today, that is 31st of March. Now, the Unacademy well-structured live courses, recorded versions, full syllabus, QBank, competitive live test and quizzes. Along with it, you can get the benefits of clinical integrated essentials, video lectures, QBank 3, active guidance, rapid revision, snapshots, all can be targeted by you, and this will be highly beneficial for you. Other than that, congratulations to the toppers of FMG December session, and wish them best of luck so that they can target their upcoming session with a very good marks. Now, other thing which is started on the platform is doubt clearing session. Unacademy live light sessions has been started, which is giving you an access of Unacademy Lite, where you can have an access to the sessions, and the test series and all can be targeted by you. You can take the sessions of smaller duration of time. The doubt clearing session will be on the Plus platform only and will be taken by the top educators of Unacademy platform. Use the code NAT10 and get an extra discount of 20%. So get an extra discount of 20%. Okay. Now, also launching the previous year question bank, where you can have an access to the previous year question bank of FMG sessions, the INICT sessions, and also of the NEET PG. So all that previous year MCQs can be targeted in the last 3 years, and you can have an access to this. Other than that, also launching the first professional course, that is MBBS Prof 1, in-depth comprehensive test topic coverage, PDF notes can be targeted, doubt clearing session. So you can use my code and get an extra discount here. NEET PG high revision batch is coming up, and you can be the part of this, already started. Focus FMG high yield MCQ marathon batch is also there. You can be the part of this. You can use my code and get an access to this sessions. Also, NEET PG end of the year sale. So when we are talking about NEET PG end of the year sale, you get an additional 20% discount on the Plus and Iconic subscription if you are going to take the subscription till 31st of the March. So till today at the end, if you are going to take the subscription, you are getting end of the sale discount, and you can use my code NAT10 to get an extra discount of 20%. Okay. So let's start with the session, that is connective tissue. So myself Dr. Monalisa, let's start with the session. So before starting the session, I would also like to tell the objective of the class. You should be able to know the classification of connective tissue with an example. You should be knowing the composition of the connective tissue, properties, types, features, fibers, important types of collagen fibers, and also the histological types of the important connective tissue sites. So all these should be grasped by you. So these all things will be completed: classification, composition, types of the collagen fibers, and the histological slides. So first thing, before starting the slide, I would also like to tell what is the definition of connective tissue. So connective tissue acts like a binding material. It is one of the basic tissue in our body which is providing structural and metabolic support to the other tissues and the organs of the body. So it is providing structural and metabolic support. It is giving structural and metabolic supports to the, okay, it is giving structural and metabolic support. It is giving structural and metabolic supports to the other tissues and organs in our body. Other than that, when we are talking about general features of connective tissue, so general feature of connective tissue is made of cells. It is having cells, fibers and ground substance. It is made of cells, it is having ground substance, and it is having collagen fibers. So the major constituent of the connective tissue is extracellular matrix. Extracellular matrix gives connective tissue provide strength and is responsible for their physical properties. So it is acting as a binding material, and it is important for us to know what are the cells residing inside, which type of collagen fibers are there, and what is the ground substance which is lying there. So that is at most important for us to know. So I would like to give the summary of the cells, different types of cells, different types of collagen fibers, and the composition of ground substance. So let's start with the components. So the components are living. So if I am talking about the components can be living and non-living. So when we are talking about living and the fixed, it can be of fibroblast, fat cells or persistent. Other than that, wandering or the moving cells are also located inside. They are macrophages, mast cells, plasma cells, pigment cells, neutrophils and eosinophils. So clearly, other than that, it will also have macrophages, mast cells, pigment cells and that of neutrophils. All these are the constituents which is wandering, and these are the cells which is wandering and moving here and there, and the fixed cells are fat cells, fibroblast and the mesenchymal cells. The fibers are of three variety: collagen fibers, elastin fibers and reticular fibers. How many? Collagen, elastic and fibers. The ground substance is made of extracellular matrix which is containing mucopolysaccharides and glyco and the other constituents which we will chondroitin sulfates, chondronectin, many of these constituents along with the water and electrolytes will be present there. So these are the whole composition. Okay, these are the whole composition. I would like to emphasize on the individual of these components, how they are arranged and what are the importance and how you are going to identify the cells, ground substance and also the matrix composition. So before starting this, let's see this slide, cells and fibers of connective tissue. So I would like to show you this. This is the cells and fibers of connective tissue. Okay. So cells and the fibers of connective tissue. Okay, cells and fibers of connective tissue. So the important cells are mast cells, fibroblast, plasma cells, small lymphocytes, plasma cells, macrophages, mast cells, large lymphocytes. So all these are the cells, and can you see in this diagram there are bundles of fibers running. So if you enlarge this diagram, if I enlarge this diagram, you can see bundles of fibers are running. Can you see here? These fibers which is shown and running here, which is in the form of bundles. So see here, these fibers are in the form of bundles and they are not branching. They are not branching. Okay, is the collagen fibers, and the other one which you can see which is branching, which is having branch, this singly running, these fibers. So singly running fibers are elastic fibers. These are what? These are single running fibers. These are elastic fibers, and the other one is the called as the collagen fibers, which is in the form of bundle. Collagen fibers are in the form of bundle and elastic fibers are singly running and having branching pattern. Now, reticular fibers has been not shown here. Why? Because reticular fibers can be stained by special stains only, that is silver nitrate. It can't be stained by the normal H&E stains. Now, what are the important types of cells? The important cells of connective tissue are fibroblast, fibrocytes. We have got fibroblasts, we have got fibrocytes, we have got plasma cells, eosinophils, adipose cells, neutrophils, large lymphocytes, small lymphocytes, macrophages and the mast cells. So these are the individual cells, and it is important for you to know these individual cells, what is the composition and all. It is very, very important for you to know. Okay. So yes. Now, So all these cells are is residing inside the connective tissue matrix of the connective tissue, and these cells has to be emphasized more. So I would like to show you a comparative table explaining this. This is a very useful comparative table made by my own senior of AFMC examination, Dr. Tandon sir. So this is very useful, and do have the comparison. So here individual cells has been shown you, and these cells are, one is the fibroblast, other is the adipocytes, so all the important one. So this is a comparative table which is showing you the comparison of important cells of the connective tissue: fibroblasts, the adipocytes, the macrophages, the mast cells, the plasma cells, and the pigment cells. Okay, pigment cells. So let's talk about the shape. So the most important thing is that fibroblast is secreting the matrix. It is an important source of secreting extracellular matrix. So it will form extracellular matrix. Adipocytes forms lipocytes and fat cells. Okay, and macrophages are the big eaters. Mast cells are actually secreting histamine and that of heparin, and mast cells. So also it is important to know that if I talk about plasma cells, it is importantly having a cartwheel appearance. I will show that image also. It is having the nucleus in the form of cartwheel arrangement and one of the periphery, and it is also having, it stores antibodies, and it is called as Russell bodies. Pigment cells is having, it contains melanin, that is again important, and it is present in the skin. Plasma cells are activated where the antibody and the protection or immunity is required. Mast cells are where located, it will be present in the area where there is inflammation, there is allergy, there is hypersensitivity. Now other important point just I want you to tell, in case of mast cell, it is very important for you to know that mast cells are getting innervated by, mast cells is actually stained by. So what are the special stains which is used for the staining of mast cells? It's toluidine blue, methylene blue, and alkane blue. Toluidine blue, methylene blue, and alkane blue. Special stains for that of adipocyte cells is, it is stained by Frogen section, Sudan 3, osmic acid, and Sudan black. So these are the basic comparison of different types of cell. Let me show you the similar image. So here you can see the fibroblast and fibrocytes, very important components secreting extracellular matrix. Here you can see this is the nucleus of the adipose cells, and this is giving you a signet ring appearance. A signet ring appearance. Okay. Now macrophages, as you can see here, macrophages are, there is having a larger size. They are very important for saving the interior of the cells from any foreign invasions. They are also called as Jane cells. Mast cells, as you can see, mast cells secretes histamine, heparin in response of any kind of reaction, in response of hypersensitivity reactions. Now here is the lymphocyte. So actually lymphocytes, plasma cells, basic component you will see in the physiology. You can correlate these cells. Plasma cells, one of the important point is that here you can see this is the nucleus, and the nucleus of plasma cells are cartwheel in appearance. What is the shape? It is cartwheel in appearance. It is cartwheel shape in appearance, and it is lying on one side, or you can say eccentric. It is located in eccentric location. What is? It is eccentric in location. It is eccentric in location, cartwheel appearance. Eosinophil, neutrophils. And let's talk about the 3 collagen fibers, and the comparison of collagen fibers are very important for you. How many types of collagen fibers are there? The important collagen fibers are the collagen are the elastic fibers, the reticular fibers, and that of collagen fibers. And we have to know the difference between 3 types of these fibers. So let's see the another comparison. Okay, so in visualizing, what you can see, the pearly white in appearance is the collagen fibers, when you will see elastic fibers yellow in color, and no particular color is given to the reticular fibers. Okay, now if we will see the fibers which is running in the bundle, so which fibers are running in the bundles? So the largest one is the collagen fibers, and it is running in the bundles. The next is the elastic fibers, and also reticular fibers are seen in embryonic connective tissue. It is seen in embryonic connective tissue. Okay. Now let's talk about the important appearance. So it will be elastic fibers is shiny, brightly and highly refractile, and HNE stain. So reticular fibers, very important. Reticular fibers are not stained by HNE, that is hematoxylin and eosins. Okay, protein on boiling it forms protein. Collagen, elastin is formed on boiling of the elastic fibers. Reticulin is formed in boiling of reticular fibers. Okay. Now, where is the collagen fibers more present? The collagen fibers are present in aponeurosis, ligaments and the tendons. Elastic fibers are present in the structures which is having more of elasticity. So posteriorly at the nape of the neck there is ligamentum nuchae where we want elasticity. So that is the location where the much more number of elastic fibers are residing. So it is having elasticity there. So also at the ligamentum flavum. What is ligamentum flavum? The adjacent part of the laminas of the vertebra is connected by ligamentum flavum. So much more number of elastic fibers, elastin and elasticity is there. So it is present in the areas of ligamentum flavum, ligamentum nuchae, and other than that reticular fibers, it is present in, reticular fibers are present in liver, spleen, kidney and also in the basement membrane. It is present in liver, kidneys and the basement membrane. Now let's talk about the special stains which can be utilized for the staining of these fibers. So when we are talking about the special stains which can be used for collagen fibers, the special stains are Van Ginsen. When Van Ginsen stain is used, the collagen fibers appears to be red. When silver nitrate is used, the collagen fibers appears to be brown. When Mason trichome is used, the collagen fibers appears to be blue. So these are the special stains. Oricene is giving the appearance black to the elastic fibers, and silver nitrate is used for staining reticular fibers, and silver nitrate is giving black appearance of the reticular fibers. So do highlight this. Silver nitrate, when staining is used for the reticular fibers, it appears black. Oricene is giving you also black appearance to elastic fibers, and special stain which can be used for collagen fibers are Mason trichome is giving its blue color, silver nitrate is giving its brown color, and also a Van Ginsen is giving its red color. Okay. Yes, hello ma'am, thanks a lot for your videos, it's a boon. Thank you so much dear, thanks dear. Okay. So yes, these are the important features and the comparative features of collagen, elastic and reticular fibers. Okay. So thereafter, let's talk about the features of the other fibers. So let's, collagen fibers. Now what I told you, collagen fibers, we have got many types of collagen fibers, but it is very important for you to know the collagen fibers here, which is generally asked. So it is very important that you should know the collagen fibers, which is most important for you to know. So when we are talking about the collagen fibers, it is made of microfibril. It also contains tropocollagen and it is responsible for striations. So the regular arrangement of collagen fibers, and collagen fibers is appearing striated. Actually collagen fibers, when it is present in higher amount, in case of for example fibrocartilage, you can see the fibrocartilage is appearing wavy. Okay. Now, the other important point is collagen fibers is not only synthesized by the fibroblast, but it is also secreted, synthesized by the other cells in the various locations. So, I would like to emphasize that chondroblast are the cells which is synthesizing the collagen fibers in cartilage. Osteoblasts are the cells where the collagen fibers are secreting in the case of bone. Smooth fibers are that which is secreting this in the blood vessel. Odontoblast is secreting in the tooth. So what are the properties of collagen fibers? Collagen fibers are secreting. The properties of collagen fibers are that they will secrete, be synthesized by fibroblasts. But collagen fibers, other cells which is responsible for the secretion, in case of cartilage it is the chondroblast, in case of bone it is osteoblast, in case of smooth muscle it is blood vessels, and in case of tooth it is odontoblast. So on boiling denaturation, what is the product form? Gelatin. Okay. So please do go through. These are the very important features of collagen fibers. My dear aspirants, I would also like to emphasize one more point. Actually, collagen variety we have got many, 25 numbers or more. But for you at this level, it is important to just know 4 or 5 types, which is very important. So let's talk about that. Type of collagen fibers. Type of collagen fibers. So type 1 collagen fibers, the main sites where it is formed is bone, tendons, capsules and dentine. So type 1 collagen fibers, the main site where it is formed is bone, tendons, organ, capsule and dentine. Now special features where it is more abundant is the typical collagen fibers having 64 nanometer banding and is more abundant in this form. And the most important one is type 1, which is found in bones, tendon. Other than that, please wrote down type 1 collagen fibers is also formed in fibrocartilage. Okay. Type 2 is formed in two of the cartilage, that is hyaline and elastic. Type 2 is formed in hyaline and elastic cartilage and very thin fibril. They are having a very thin fibril. Type 3 is called reticular fibers and this is present in association with type 1 reticular fibers. One more thing is very important where reticular fibers are residing. Reticular fibers are in more number and in more distributed. It is found in association with lymphoid structures and lymphoid organs also. So one of the most important point which is generally asked in MCQ is all lymphoid structure is having reticular fibers as the supporting network except. The answer is epithelio-reticular cells. Epithelio-reticular cells. So please write down this information. All reticular fibers, now all lymphoid structures, that means organs, have reticular fibers as connective tissue framework, except, the question is except which, the answer is except. So the except is thymus gland, except thymus gland, because in thymus gland there is no presence of reticular fibers, but thymus gland is having which structure as the supporting network? Thymus gland is having epithelio-reticular cells. Thymus gland is having epithelio-reticular cells as the supporting network. It is having epithelio-reticular cells as the supporting network. Got it? Now let's move on to the next. Other than that, type 4 collagen fibers, if I am talking about type 4 collagen fibers, it is present in basal lamina, associated endothelial cells, and type 5 is associated with the basal lamina of the muscle. So please have a look on the type of collagen fibers, main sites and the special features. Now let's talk about the ground substance. So thereafter let us describe the ground substance. What is ground substance? So ground substance is viscous transparent homogeneous solution. It is viscous transparent homogeneous solution. It is homogeneous in composition. Ground substance is filling the space in between the cells and what is the role? It is filling the space in between cells and the fibers. It is filling the space between the cells and the fibers. It is consist of mucopolysaccharides. It is composed of glycosaminoglycans, namely hyaluronic acid, heparin sulfate. So please note down, mucopolysaccharides are residing. My dear aspirants, it is also important for you to know the important glycoproteins. So that there is specific name of glycoproteins in different area. So my dear aspirants, when we are talking about glycoprotein, fibronectin is the glycoprotein in the dermis. Chondroitin is the glycoprotein in the cartilage, and lamellin is the glycoprotein in the basement membrane. Laminin is the Chondroitin is the important, chondronectin is an important ground substance in the cartilage. Chondronectin, fibronectin in the dermis, and lamellin in the basement membrane, waters and electrolytes. Other than that, ground substance will have electrolytes and also the waters. Okay. So, specifically this is important for MCQ. Which type of glycoprotein is residing in the dermis? Fibronectin. The name of the glycoprotein in the cartilage? Chondronectin. The name of the glycoprotein in the basement membrane? Lamellin. Got it? So, these are whole details of the ground substance. Okay. Now, the function of ground substance is to give support. It is supportive, packing, storage. It is acting as a packing material. It is also utilized for transport, repair and defense mechanism. Now, classification of connective tissue. Now, let's talk about how we are going to classify the connective tissue, and by seeing the properties of the types of cells residing inside, types of fibers and amount of ground substances located. So, classification of connective tissue. Let's talk about classification of connective tissue. The classification of the connective tissue is as following. Okay. So, ordinary connective tissue is having loose areolar tissue and dense collagenous, and again it will have a special feature. Scleral type is bone and cartilage, lymphoid. So, we will study in detail about lymphoid organs, spleen, lymph node, thymus gland and tonsil in a separate session, and the hemopoietic is the blood and blood forming organs. So, for your MCQ session, and as it is seen in the previous year of NEET PG exam, and also very important for your next session is to know the example of each variety and where it is located. So, let us talk about the first variety, that is ordinary. What is it? That is the ordinary connective tissue. Let us talk about ordinary connective tissue. So, when we are talking about ordinary connective tissue, that is loose areolar connective tissue, it is vascular, it is delicate and it is flexible connective tissue. It's vascular, it is delicate, it is flexible connective tissue, but the arrangement of the connective tissue is loosely arranged. It is loosely arranged. Okay, it serves as a packing material which is important for filling the space of the various component of organs, and it also forms a shape. So, the example, please note down the example of loose connective tissue. Loose connective tissue, the example of loose connective tissue is, it is present in subperiosteal tissue, it is present in subperiosteal tissues, it is present in lamina propria. So, lamina propria layer is lying in the GI tract, it is lying in the respiratory tract, and it is also present in endomycecum. What is endomycecum? The fascia covering the muscle fibers, it is also present there. So, also you can see here in this diagram, this is in large view where you can see the loose connective tissue. The loose connective tissue is clearly this fibers which is running from here to here. These are the collagen fibers which you are seeing, these are the collagen fibers. Other than that, in between you can see brightly stained fibers singly running like this, in between whole of it is running like this. What are these? These are elastic fibers, these are elastic fibers which is running here. Now ordinary connective tissue. Let's talk about ordinary connective tissue. When we are talking about ordinary connective tissue, the following types of ordinary connective tissues are there. Okay. Now, this connective tissue, when we are talking about the other connective tissue will have dense. So, one already talked about the loose connective tissue. When the connective tissue is densely packed, we have got collagen fibers which is giving tensile strength, and the packing of collagen fibers is to increase the resistance and the strength. Subperitoneal, subperiosteal, no, peritoneal dear, peritoneal, it is peritoneal, subperitoneal, okay, subperitoneal, below the peritoneum, subperitoneal. Surbi, it is subperitoneal, sorry, it is subperitoneal, please do make it correction, it's subperitoneal, yes, it is subperitoneal. Now, dense collagen connective tissue, it is tensile. Loose connective tissue, dear, loose connective tissue is whenever you will see the any of the important slides where you can see the collagen, loose connective tissue means it is associated with the organs, dear, it is associated with the organs, okay. So loose connective tissue means, for example, peritoneum. Below the peritoneum we have got loose connective tissue, okay. It's very fatty. It's very fatty. So for example, when you go for dissection also, you remove the skin and then you get the fatty layer, that is loose connective tissue. That is loose connective tissue. And lamina propria is the very good example. So when you will study about GI tract, gastrointestinal tract, when we will study about respiratory tract, so there are layers, okay. There is mucosa layer, submucosa. In that mucosa layer, there is a layer of loose connective tissue. In this loose connective tissue, there is blood vessels, nerves residing, and fatty layer. It also contains fats, okay. So it is lying in the various organ also as a loose packing material, So yes, dense collagen connective tissue is having a tough tensile connective tissue. Collagen fibers are densely packed, giving strength and resistance to the traction force. The arrangement of the ordinary connective tissue either can be regular, or can be irregular. Okay, thank you, should be Srivastava. So yes, where the collagen fibers are densely packed in orderly manner, they are regular arrangement, and the regular arrangement is seen in case of tendon, aponeurosis and ligament. Regular arrangements can be seen in case of tendons, it can be seen in cases of aponeurosis, and it can be seen in the cases of ligaments. Irregular, when we are talking irregular, so the irregular collagen fibers are oriented in different direction, and the irregular arrangement is seen in the dermis of the skin. It is seen in the dermis of the skin. So the skin layer is superficially is the epidermis, below it is having the dermis. So it is present in dermis. Now let me show you the regular dense connective tissue image. So here you can appreciate the regular dense connective tissue. Here you can clearly appreciate the fibroblast nuclei has been shown, bundle of collagen fibers, wavy appearance. So whole slide is showing you a wavy appearance. This wavy appearance of collagen, wavy appearance is of collagen fibers, which is nicely arranged in a very regular pattern. So only tendon is an example of regular collagen dense, regular dense connective tissue. In between is the connective tissue, and so see here, in between is the connective tissue, loose connective tissue will be lying in between, which will contain the vessels, nerves and vessels. Now dense, regular dense connective tissue, when we are talking about regular dense connective tissue, the very good example of regular dense connective tissue will be the tendon. Okay, tendon is a very good example of regular dense connective tissue. So here in this diagram, you can clearly see the collagen fibers are shown. The collagen fibers are showing a wavy appearance. Collagen fibers are in the form of showing a wavy appearance. A wavy appearance is there. Fibroblasts are residing there. Fibroblast. So see here, fibroblast will be in between. Collagen fibers are showing you the wavy appearance. Okay. Other than that, you can have the tendons, as you can see here. So the tendons are residing here, transverse section. Now irregular dense connective tissue, the other example of irregular, when the arrangement of collagen fibers are irregular in nature, in different direction, it becomes a example of irregular connective tissue, and the example is dermis of the skin. Below epidermis, just below the epidermis of the skin, you can see the dermis layer in which fibroblast is also residing, and in this dermis you can see the arrangement of collagen fibers and all the layers of all the important constituents of loose connective tissue is very irregular here and there, not a regular arrangement of collagen fibers. Now let's talk about the other connective tissue, the connective tissue having special properties. Now let's talk about the connective tissue which is having special properties. Elastic tissue. So elastic tissue is made of elastic fibers. It is found in the places where we have got elasticity. So where we have got an elasticity. in the location of ligamentum nuchae, back at the nape of the neck. Mucoid tissue. What is mucoid tissue? Mucoid tissue is embryonic connective tissue which is made of Wharton's jelly, Reticular tissue, when we are talking about reticular tissues, so reticular tissue is modified connective tissues which is made of reticular fibers and the cell. Reticular tissues are made of reticular fibers and cells. It provides structural supports to the cellular organ stroma of lymphoid organ. Adipose tissue, when we are talking about adipose tissue is made of hypodermis, and the example of adipose tissue is panicula's adiposis. Ordinary connective tissue. Okay. Example, hypodermis, panicula's adiposis. Embryonic connective tissue containing Wharton jelly, mucoid tissue, reticular tissues, reticular fibers. As I told you, it is forming a supporting network for lymphoid structure. So, reticular fibers will be found in association with, the stroma of lymphoid organ, which we have already talked. Only thymus gland is not getting the reticular fibers as the supporting network, and here the example is the epithelio-reticular cells. Ligamentum nuchae, example of elasticity, elastic tissue. Mucoid tissue, in the embryonic connective tissue, Wharton's jelly. Adipose tissue, it is present just below the skin, it is called as panicula's adiposis. Now, you can also appreciate ligamentum nuchae. You can see a ligamentum nuchae is full of elastic fibers. So, the slide is showing you full of elastic fibers which is providing more of elasticity. Now, umbilical cord. So, you can see here umbilical cord, that is Wharton's jelly. When we are talking about umbilical cord, in umbilical cord is having Wharton's jelly. Okay. So, umbilical cord, if you will see, which will have mucous connective tissue is residing inside, and it is made of inside there will be the umbilical artery and vein, and it is called as Wharton's jelly. Very mucoid connective tissue is residing here. Reticular fibers, so special stain is there, and black color lines which you are seeing, which is marked by the red arrow, these are all showing you reticular fibers. Reticular fibers are visible in the special stain, that is the silver nitrate stain. Silver stain is a special stain utilized for seeing the reticular fibers. It is not visible in H&E stains. Very important composition, very important for the structural support of lymphoid organ. Adipose. So, let us see the slide of adipose cell. So, let me highlight it. So, you can see this is adipose, this is also adipose. So, it is not taken stain, and fat globulin, but one of the basic feature which you can appreciate here, the nucleus. So, it is have one nucleus at the periphery. So, it will have one nucleus at the periphery. So, this is adipose having one nucleus at the periphery. So, this is having one nucleus at the periphery, and this is also called as signet ring appearance. What is the appearance? The appearance is signet ring appearance. So, in case of the mammary gland, many of the adipose cells can be visualized. In case of mammary gland. Now, scleral connective tissue. Now, let us talk about scleral connective tissue. When we are talking about the scleral connective tissues, it provide when we are talking of scleral connective tissue, it provide a general framework of the body, and it is stiff connective tissue where in special one scleral tissues, the cartilage and the bones, it will be taken as a separate class, in which the histology of cartilage and bone will be studied in much more detail. And the other one is lymphoid tissue and lymphoid structures. In this we have to study 4 slides, that is spleen, the lymph node, the thymus gland, and that of thyroid gland. So, yes, in this category lymphoid tissue can be studied in much more detail when we are talking about the important features of the lymphoid tissue, hemopoietic blood and blood forming organs, mainly blood components can be studied more in the physiology part. Lymphoid tissue, a separate histology session will be taken in which these 4 slides should be studied in much more detail, because this is very important for your upcoming sessions and your upcoming exams next, and also for university examination. So other than that, before ending the sessions, few important announcements which I want you to tell. Today is the last date, my dear aspirants, today is the last date to take the NEET PG end of the year sale. So today you will get an additional 20% discount if you are going to plan and take the Plus or the Iconic subscription. You can use my code ANAT10 and you will have an additional discount of 20%. You will have an additional discount of 20% if you are going to take the subscription today, that is 31st. Today is the date, that is 31st of the March. Until today, if you are going to plan and take the subscription, you will get an additional discount of 20%. So utilize this. And the students who are wanting to take a comprehensive study along with the preparation of MBBS course, along with the preparation of their next examination, so definitely opt for taking this chance of getting 20% discount. Use my code, this will be highly beneficial. So already talked of, so before ending the session, thank you, and I would also like to tell, already talked about the connective tissue in detail. Connective tissue will be found in every of the cells and the tissues which you discussed. For example, epithelium, which will found in the histological slide. Same way, connective tissue will be found in many of this of these slides which you will study. It will be found in the skin, it will be found in relation to GI tract, it will found in relation to respiratory tract, it will found in the elastic cartilage, it will found in the elastic artery, so many of elastic fibers. So it is well associated structures. So that is the whole aspect. So also do like, subscribe the channel and share the Let's Crack NEET PG channel. All the best, keep studying. So again, today itself I am taking 2 more sessions. I will start another half an hour after that. I will start 2 sessions, one on the Let's Crack NEET PG, another that session, 2 sessions on the Let's Crack NEET PG only. So do join live, it will be highly beneficial. Thank you so much, all the best, keep studying. It is a mixed bag anatomy MCQ session. The session is mixed bag anatomy MCQ session, and that will be highly beneficial for you. Mixed bag anatomy MCQ session. All the best, keep studying. Thank you so much. Let's meet with the upcoming session. Let's catch up you in the Let's Crack NEET PG platform. Thank you, all the best. Thank you, my dear aspirants.